Following the outbreak of Mpox disease in Uganda, many partners have come on board to support towards combating the disease. Today, Ministry of Health received Monkey Pox sample collection materials from World Health Organization worth 56 million Ugandan shillings to help towards the response of Mpox disease in the country.
You may clap for us. Okay.
The sample collection materials have been received by Dr. Charles Oraro, Director Curative Services, on behalf of Director General Ministry of Health.
We have procured these items with generous funding from the Federal Republic of Germany. This contribution aims to support the Ministry of Health in ongoing Mpox outbreak response across the country.
World Health Organization Country Representative Dr. Njuguna says that the scraps will contribute towards national response to such outbreaks.
The materials being handed over today are essential for ensuring accurate and timely diagnostic testing, which is critical in controlling the spread of Mpox. With these swabs, district and health care facilities across the country will be better equipped to collect samples from suspected cases.
He adds that World Health Organization is committed in ensuring that Mpox is fully combated in Uganda.
The provision of these swabs will not only strengthen Uganda testing capacity, but also contribute to the overall national response to this outbreak. The World Health Organization remains committed to supporting Uganda in building a resilient health system capable of responding to public health threats such as Mpox.
Dr. Njuguna adds that early detection of outbreaks is very key because it makes it easier for the concerned bodies to respond and stop transmission.
Early detection of cases is very, very important. While the Ministry of Health is putting all the efforts in place, that is not enough unless the community is also on board to help us to pick these cases early. And once we pick them early, this kind of supplies that we are handing over today will be very useful to help us in collection of samples and shipping those samples to reference laboratories that have been designated for testing.
Dr. Charles Oraro, Director Curative Services, on behalf of Director General Ministry of Health, assured Ugandans that the Ministry of Health is taking control of the disease, saying that the communities don't need to worry.
The response and the disease is under control, and the community should continue and the population should continue to do what their work normally without interruptions, but only we urge them to remain vigilant. We want that if there are any cases which is identified, let's be able to move to the nearest health facility for us to be able to work.
He raised the concern for people with Mpox being stigmatized, which he condemned, saying that the disease is curable, they need to be handled with care.
People who have Mpox with the symptoms consistent with Mpox should not be stigmatized, but they should be handled with the compassion and the care. Much as disease is contagious, but it's curable. I think that's really key. So we really want that the community stays informed.
Currently, 24 patients have been diagnosed with Mpox from districts of Mukono, Adjumani, Nakasongora, Kampala, Kagadi, Nakaseke, Amuru, Wakiso, Mayuge, and Kasese. Out of the 24, there is no reported death case and 13 have recovered. JULIUS MUHUMUZA, Church of Uganda Family TV, News at 8.